Greetings, my friends. This is Dr. Jaime Daniel, and today, as usually, I'm going to bring you an overview about juvenile idiopathic arthritis. Like adults, children can develop arthritis. The most common type of chronic or long-standing arthritis that affects children is called juvenile idiopathic arthritis. Juvenile idiopathic arthritis broadly refers to several different chronic disorders involving inflammation of joints, which can cause joint pain, swelling, warmth, stiffness, and loss of motion. The various forms of juvenile idiopathic arthritis have different features, such as the pattern of joints involved and inflammation of other parts of the body besides the joints. Juvenile idiopathic arthritis may last a limited time, such as a few months or years, but in some cases it is a lifelong disease that requires treatment into adulthood. Juvenile idiopathic arthritis is idiopathic. It means that its origins are not understood. While the exact cause of juvenile idiopathic arthritis are unknown, it begins when the immune system becomes overactive and creates inflammation. With treatments, most children achieve periods of wellness, remission, and sometimes the disease goes away permanently with no further need for medication. It is important to see a doctor early if your child has swollen or stiff joints because delayed therapy can lead to joint damage, a lesser response to treatment, and other problems. By definition, juvenile idiopathic arthritis begins in children with adolescents before the 16th birthday. Most types of the disease are more frequent in girls, but enthesitis-related juvenile idiopathic arthritis, a form of the disease that involves inflammation of the places where ligaments and tendons, flexible bands of tissue attached to bones, is more common in boys. Systemic juvenile idiopathic arthritis, a rare type of juvenile idiopathic arthritis that features fever rash, affects boys and girls equally. Children of all races and ethnic backgrounds can get the disease. It is very rare for more than one member of a family to have juvenile idiopathic arthritis, but children with a family member with chronic arthritis, including juvenile idiopathic arthritis, are at a slightly increased risk of developing it. Having a family member with psoriasis is a risk factor for a form of juvenile idiopathic arthritis called psoriatic juvenile idiopathic arthritis. There are multiple types of juvenile idiopathic arthritis, each with distinct features. Generally, they all share arthritic symptoms of joint pain, swelling, warmth, and stiffness that last at least 6 weeks. Some types are like oligoarticular juvenile idiopathic arthritis. This is the most common and mildest form, affecting 4 or fewer joints. It is considered persistent if symptoms continue for 6 months or longer, and extended if 5 or more joints become involved after 6 months of illness. Commonly affected joints are knees or ankles, A form of eye inflammation called chronic uveitis can develop in children with this form of juvenile idiopathic arthritis. About half of children with juvenile idiopathic arthritis have this type. The second type is the polyarticular juvenile idiopathic arthritis, rheumatoid factor negative. This is the second most common type, affecting 5 or more joints in the first 6 months. Tests for rheumatoid factors are negative. The rheumatoid factor blood test checks for autoimmune disease, especially rheumatoid arthritis, which is an adult form of arthritis. Some of these children develop chronic uveitis. Another type is the polyarticular juvenile idiopathic arthritis, rheumatoid factor positive. A child with this type has arthritis in 5 or more joints during the first 6 months of the disease. Tests for rheumatoid factor, a marker for autoimmune disease, are positive. It tends to occur in preteen and teenage girls, and it appears to be essentially the same as adult rheumatoid arthritis. Another type is the enthesitis-related juvenile idiopathic arthritis. This form of juvenile arthritis involves both arthritis and enthesitis. The enthesitis happens when inflammation occurs where a ligament or tendon attaches to a bone. The most common location for enthesitis are the knees, heels, and bottoms of the feet. Arthritis is usually in the hips, knees, ankle, and feet, but sacroiliac joints at the base of the back and spinal joints can also become inflamed. Some children get episodes of acute anterior uveitis, a sudden onset of inflammation of the front of the eye. Unlike most other forms of juvenile idiopathic arthritis, enthesitis-related juvenile idiopathic arthritis is more common in boys. Another type, psoriatic juvenile idiopathic arthritis. Children with this type have psoriasis, skin condition, as well as inflammation of the joints. The skin condition usually appears first, but sometimes painful. Stiff joints are the first sign, with the skin disease occurring years later. Pitted fingernails and dactylitis, swollen fingers or toes, are also signs of the disease. Systemic juvenile idiopathic arthritis. Systemic means the disease can affect the whole body, not just a specific organ or joint. Systemic juvenile idiopathic arthritis usually starts with fever and rash that come and go over the span of at least 2 weeks. In many cases, the joints become inflamed, but sometimes not until long after the fever goes away, and sometimes not at all if treatment is started quickly. In severe forms, inflammation can develop in and around organs such as the spleen, lymph nodes, liver, and lining of the heart and lungs. Systemic juvenile idiopathic arthritis affects boys and girls with equal frequency. And last, the undifferentiated arthritis. This category includes children who have symptoms that do not fit into any of the one types or that fit into more than one type. Symptoms of juvenile idiopathic arthritis. vary depending on the type, but all forms share persistent joint pain, swelling, warmth, and stiffness that are typically worse in the morning and after a nap or prolonged sitting. The pain may limit movement of the affected joint, although many children, especially younger ones, will not complain of pain. One of the earliest signs may be limping in the morning due to disease in one or both legs. The symptoms of juvenile idiopathic arthritis may go through cycles, flaring for a few weeks or months, followed by periods when they go into remission. Some children have just 1 or 2 flares and never have symptoms again, while others may have flares or symptoms that never fully go away. Besides joint problems, the inflammation associated with juvenile idiopathic arthritis can cause other symptoms such as eye inflammation, known as uveitis. It often occurs in children with juvenile idiopathic arthritis. It usually starts within a few years after the juvenile idiopathic arthritis diagnosis, but in a small fraction of children. It appears before the joint symptoms or many years after. The type of juvenile idiopathic arthritis a child has may cause the development of different types of uveitis. Children with olivoarticular juvenile idiopathic arthritis, especially when it begins at an early age, can have chronic uveitis that has mild or no symptoms. Children with polyarticular juvenile idiopathic arthritis without rheumatoid factors or with psoriatic juvenile idiopathic arthritis are also at risk. Enthesitis-related juvenile idiopathic arthritis and some children with psoriatic juvenile idiopathic arthritis can have episodes of acute anterior uveitis, which has a sudden onset and causes eye pain, eye redness, and sensitivity to light. If left untreated, uveitis can lead to eye problems such as cataracts, glaucoma, and vision loss. So it is important for children with juvenile idiopathic arthritis to have frequent eye exams. Skin changes depending on the type of juvenile idiopathic arthritis a child has. He or she may develop skin changes. Children with systemic juvenile idiopathic arthritis who have fever can get a light red or pink rash that comes and goes. Psoriatic juvenile idiopathic arthritis can develop scaly red patches of skin. Psoriatic juvenile idiopathic arthritis can also cause pitted nails and dactylitis, known as swollen fingers or toes. Polyarticular juvenile idiopathic arthritis with rheumatoid factors can get small bumps or nodules on parts of the body that receive pressure, such as from sitting. Fever. In some patients with systematic juvenile idiopathic arthritis typically have daily fevers when the disease begins or flares. The fever usually appears in the evening and the rash may move from one part of the body to another, usually happening with the fever. Patients with other types of juvenile idiopathic arthritis do not generally develop fevers. Growth problems. Inflammation in children with any type of juvenile idiopathic arthritis can lead to growth problems depending on the severity of the disease and the joints involved. Bones near inflamed joints may grow too quickly or too slowly. This can cause one leg or arm to be longer than the other, or can result in a small or misshapen chin. Overall growth also may be slowed if the disease is severe. Growth normally improves when inflammation is well controlled through treatment. In juvenile idiopathic arthritis, the body's immune system, which normally helps to fight off infections and heal cuts and wounds, mistakenly attacks some of its own healthy cells and tissues. The result is inflammation, marked by pain, swelling, warmth, and stiffness. Inflammation from juvenile idiopathic arthritis can damage the joint, eyes, or other affected organs. Scientists do not know why the immune system attacks healthy tissue in children with juvenile idiopathic arthritis, but they believe that a complex mix of genes and environmental factors are involved. While the origin of the immune system's overreaction in juvenile idiopathic arthritis is unknown, scientists have identified some of the molecules that contribute to inflammation in some forms of the disease. There is no single test that doctors can use to diagnose juvenile idiopathic arthritis. However, they may suspect that a child has the disease if he or she is younger than age 16 and has unexplained joint pain, stiffness, or swelling that has lasted for at least 6 weeks. Doctors usually diagnose juvenile idiopathic arthritis, ruling out other conditions that have similar features. In order to do that, they will use your medical history and physical exam. Also, they may ask you to get some lab tests. Additionally, the use of imaging studies will help to get a diagnosis. And when you start your treatment, you need to get some goals in order to improve your health care condition. These goals include control inflammation, reduce pain and stiffness, prevent joint and organ damage, preserve and improve joint function, promote physical and psychological growth and development, achieve remission, allow for full engagement with normal activities. Most children with juvenile idiopathic arthritis need a combination of medicines and a healthy lifestyle, including a balanced diet and exercise, to reach these goals. The specific treatment plan will depend on the child's age, the type of juvenile idiopathic arthritis, and on other factors such as disease severity, In general, doctor will treat the disease aggressively early on, tapering off medications once remission is reached. Once you have started your therapy, you need to remember that there are some medications that may be prescribed for you, like anti-inflammatory and pain medication. They can help alleviate pain and swelling from inflammation. They are often prescribed by doctors, but some are also available over the counter. Also, we got the disease-modifying anti-rheumatic drugs, biologic response modifiers, and the corticosteroids. The physical therapy can be an important part in juvenile idiopathic arthritis treatment. You may be recommended physical therapy to help you in relieve pain, improve and maintain range of motion in affected joints, strengthen muscles, prevent injury from sports or other physical activities. A physical therapist can also teach pain-reducing techniques and develop a home exercise program for your child. Living with juvenile idiopathic arthritis affects the entire family. All family members must cope with the special challenges of the disease. Having juvenile idiopathic arthritis can strain your child's participation in social and after-school activities and make schoolwork more difficult. Nevertheless, it is important to treat your child as normally as possible. Certain activities can help improve children's ability to function on their own and maintain positive outlook. These include things like managing medical care, balance, rest, and exercise. Also, take care of your joints. The partners with your child's school need to learn how to help him. Also encourage a healthy diet. Help your child to cope with the stress. Well, I hope you enjoyed this episode and we will see you in the next one. Thank you.